When testing these patients, I often find that the type of alcohol which they crave and tend to indulge in may be actually allergic. For example, a person who prefers vodka is commonly allergic to potato. A person who has a lot of wine as part of their alcoholism is commonly allergic to yeast and grape. So this got to me thinking that the alcohol aspect is partly allergic in nature, just from my day-to-day experience. Now, beyond that, I also test every patient for potential of hypoglycemic state. And invariably, persons with alcohol problems test that they have a hypoglycemic tendency, which is that their blood glucose level is unstable, and it tends to vary both up and down, but especially falls rapidly. And at that point, they're in a hypoglycemic state. In that state, the brain is not fueled properly. It is not getting its glucose as its fuel, and is very, very off balance. And for some reason, alcohol seems to give people some relief in that situation.
The brain is only 3% of the body weight, but it burns up 25% of the body's energy. And it utilizes that because it's a very high energy operation. It's always going and replacing things and doing work, even while sleeping. So the brain then gets the alcohol, and the alcohol is toxic to the brain. And then in addition to that, the alcohol causes injury to the intestinal tract, which the person doesn't absorb the right types of food, loses appetite, and also winds up eating junk food. And about 60% of the calories are coming from alcohol, which has virtually no nutrients in it. So the brain then gets malnourished. So you have a malnourished, toxic brain that ceases to work properly.
Weight problems are very interesting. People don't realize that overweight people are not really suffering from a lack of willpower. It's not a willpower issue at all. The body is actually really telling them that it needs something that they're not getting from the food they're eating. Now, mostly what's lacking in our food supply today is the minerals, and it is really surprising how quickly, after a person starts using the colloidal minerals, getting the full range of all the minerals that were previously lacking from their diet, they find that their cravings, their constant gnawing cravings for sweets and other junk foods or snack foods actually disappears.
Another common symptom that may have a contribution of allergy is premenstrual syndrome, or PMS, in women. Swelling, irritability, depression, and food allergies are not uncommon in this situation. If I have women and I have them get off sugar and alcohol and cow's milk and wheat as a trial, oftentimes in a month or two their menstrual symptoms are much less.
A lot of people have problems sleeping. I strongly advise that if a person is having difficulty falling asleep or waking up frequently during the night or waking up extremely early in the morning, and especially if you're tired during the day, that's an extremely unhealthy practice. Nutrition and lifestyle plays a real important role, and it may be that you cannot detoxify if you're suffering from sleep disorders. So restful sleep, with its release of melatonin and growth hormone, may play a real important role in the functioning of the immune system and the ability to detoxify.
We now believe that attention deficit disorder is directly related in a high percentage of those suffering from it from cerebral allergies. Dr. Doris Rapp, leading pediatrician and allergist, has been investigating the role between attention deficit disorder and allergens.
The estimates are that there may be as many as 8 million children who have this problem by the year 2000. Now, if you go back about 40, 50, 60 years ago, once in a while you'd have a hyperactive child in the classroom, but somebody has to sit back and say, why are so many children hyperactive? If you go back just 2 or 3 years, you'll find that the school nurses might be giving Ritalin to 1 or 2 children. Now they're giving, in some schools, to as many as 60 at lunchtime. What are we doing wrong? I think what we're doing wrong is this. we have managed to pollute our air, our food, our water, our homes, our schools, our workplaces, and our clothing, and we can't continue to do it.
In the last 10 years practicing pediatrics, I have seen a sharp increase in the number of children that comes to my office with the diagnosis already made of attention deficit disorder, and sometimes with the diagnosis of hyperactivity or a combination of both.
We believe through our research with writing our book, ADD, The Natural Approach, that ADD is actually believably overdiagnosed and overprescribed. It is an easier, simpler way for the families to work with the children that have a behavior problem, as opposed to going with the long term, which can be sufficiently worked through nutrition and also through family counseling.
Let me talk for a minute about how do you recognize if your child who's been labeled ADD really has an environmental illness. Well, first of all, there are physical clues. Their ears get red. Their cheeks are too red. They have wiggly legs. They may have classical nose allergies and go like that and push their nose in the air. They may make funny little throaty sounds or clucky sounds, which incidentally frequently signifies they might have a milk allergy. This is the way, and they have dark eye circles and bags under their eyes and wrinkles under their eyes. These are clues that there may be more there than just ADD. Now the next thing is, how do they act? Well, many of these children who have ADD, of course, are impulsive, they can't concentrate, and they tend to be easily distracted. That's basically what ADD is. But all of those characteristics can be caused by exposures to dust, to pollen, to molds, to foods, to chemicals. And the question that you have to figure out is, does my child have this ADD or ADHD, or does my child have a sensitivity to something in the environment or something they're eating that maybe if I could find out what it is and get rid of it, they'd stop having problems?
One of the main symptoms of ADD is a very short attention span. These children cannot pay attention for more than a brief period of second to a particular subject. So they are jumping from one area to the other. And so these children become disruptive, inattentive, unable to concentrate, unable to capture the message mainly from the teacher or from the parents.
The major foods that cause problems are generally thought to be red food coloring and sugar, but it can be a gamut of foods. For example, it can be milk and dairy products, and you can tell if it's milk or dairy products if you absolutely love milk or hate milk, or if you hate milk and love cheese and ice cream. Watch out, you're probably sensitive to milk, and it may not cause hyperactivity, might cause chronic ear infections and bedwetting, but it certainly can cause behavior and learning problems. Second thing is wheat, which is bread and cake and cookies, eggs, chocolate, corn flakes, corn products, popcorn, for example. Even the smell of popcorn can do it. Dyes, preservatives, and some of the juices can cause problems, particularly apple, orange, grape, and pineapple. And the juices in milk, incidentally, can also cause bedwetting at night after the age of 5 years. And the answer, again, is not to give your child an electric shock in the middle of the night when he wets the bed, but find out what he's eating at bedtime or what he's drinking at bedtime and see if that's what's causing the bladder to go into spasm. In other words, some things that you eat make your lungs go into spasm so you have asthma, but other things will cause your bladder to go into spasm, which will cause you to wet the bed. Or in adults, it'll cause the blood vessels to go into spasm and raise your blood pressure or increase your pulse. So there are different things. It's sort of potluck which area of the body is affected, but almost any area can be affected, in my mind, by almost anything. And it's potluck whether you're going to develop asthma or hay fever or behavior or learning problems in relation to various and sundry exposures.
The correction for the children with attention deficit disorder traditionally has been to offer a mood modifying drugs called Ritalin.
Is with the 6 million children that are prescribed and are given Ritalin on a daily basis, or